Hello, and welcome to another episode of Healthcare Leadership Insights Podcast. I'm your host, Mike Sloan, and today we are excited to have Brooke Eisenhart with us. She is the CEO of Integrated Healthcare Mobile Solutions. Brooke, thank you for being here today.
Hi, thanks for having me.
So tell us a little bit about yourself and how did you start IHMS of Arizona?
Yeah, I've been working with IHMS for about 8 years now. We obviously deliver care to elderly people in the home, disabled people in the home. We offer all kinds of services that you can imagine that someone would need in the home so they wouldn't have to go to the doctor's office or go to the hospital. Some of those things are like labs, mobile cardiology, dermatology, primary care, podiatry, you name it, we do it. So if it's something that needs to be done in the home, we do it. And sometimes we do transitional care where someone gets out of the hospital and they need it. We will do that as well.
Tell us a little bit about your background. What kind of education did you have in order to start these types of companies? What did you hear?
Well, I actually started all the way from the beginning. So I actually started off as a certified nursing assistant and did the hardest work I still have ever done to this day. Total care patients, quadriplegics, paraplegics, 20 on a floor. It was the hardest work I've ever done. I did the LPN, I did the RN, I did, the FNP, and then obviously the master. So I think that and all of that time I was doing clinical work. So I was always out there on the floor. I worked in every unit you could imagine. But I learned everything that what everybody does all the way through. So now as a business owner, I understand what piece everybody plays. It's really, really important in any business or practice.
So at your time working in that capacity, was there something you saw that was problematic where you realized Integrated Health Mobile Solutions was like a viable business option? Like at what point were you like, this is not available out there, I need to do something about it?
Yeah, absolutely. So my first couple jobs as a nurse practitioner, I was an ENT specialist for a while, and I started to work with the insurance companies to add more to bring down their bottom line. And to bring down their bottom line, it was trying to figure out what the cost of each patient was when you get in the hospital and what it's going to cost them and what I can do to prevent that for them. So my job was to figure out what all of the illnesses were, so each patient was actually reimbursed the correct amount that they would need to cover their, expenses. But in the meantime, I kind of got recruited from another company, and they wanted me to build their house call program. And in both of those experiences, what I learned was that if you don't have the resources to be able to take care of these patients, it was an impossible task. I could do all the care that I wanted, but if I didn't have any resources to actually make sure they stayed out of the hospital, it was I was stuck. And so in watching all of these mistakes and wondering, okay, how can I do this better? I said, well, maybe I could build a model where I could offer all of the services that people need to keep them out of the hospital. And so that's kind of where the idea from IHMS formed. And then organically, I created all of the platform of what I needed to build the business. So using, building, all of the services and all of the relationships and doing all of that first before even bringing the patient population in and then bringing in the providers. Because if you don't have a solid platform for a healthcare business like this is a very futile business.
And you're billing insurance companies for your services, or is it mostly Medicare? Are hospitals paying you to reduce reimbursement rates?
Yeah, it's mostly Medicare, but it's also, we take every insurance under the book. That was one of my rules when we started, was that we were going to try to get credentialed with every insurance company that we could, no matter what. It didn't matter if they were access, low paying, whatever, because to me, if you're going to help every patient you possibly can, if you have a limitation on insurance, that person that really needs help is not going to be able to use any of your services. So that was actually really challenging when you first start a practice, because it takes a while to get credentialed with each one of them. And a lot of them will not offer you contracts. That goes back to why I think relationships are so important. Every relationship that you build, especially in the healthcare field, you have no idea at what point later on it might be a good one to have. So even if it's someone you don't work with now and you think, oh, probably never, you never know. You never know when you're going to run back into somebody and, they might help you. And as long as you do a good job, they're usually willing to help you. You know what I mean? In any situation. So
it's so true. And do the payers in your conversations with them, have they experienced this issue in other areas? I mean, you have a focus in Arizona, right? So have they said like, oh, we need a company like this in Texas or in Alabama or whatever? Or is it a common service in your area? What's the competition like over there?
It's not very common. There are a few people that do mobile visits, but it's very segregated, meaning they only have maybe one service that they offer or like a partial service. And we've actually had a lot of companies that have tried and failed because of the futility in this business. Mobile is one of those things where you have to really be in it all the time because it's not like where you're in an office and you turn out 1,000 patients a day. I mean, it's easy. You can do procedures. This is something where a doctor has to go drive to each visit, and there's only so much reimbursement for each visit, and there's only so many procedures you can do in the home. So it's a very limited market when it comes to, if you're in it to make, buco bucks, this is not the opportunity for you. But, and if you love it, I mean, I could never be in the clinic again. I love going out to the homes and I love seeing patients, and the elderly people are so kind and their stories. I mean, it's just a different generation. And I always think, God, what will it be like in 30 years or 40 years from now? Will people who, will they not have those couples that have been married for 100 years and, they're arguing over the most ridiculous things. And, there could be a huge change just based on, how it goes. Maybe that means I'm getting older, being in my 40s, talking like an old person now. So I'll be quiet.
No, so it kind of falls for people who don't need like inpatient rehab, don't need skilled nursing facility or anything like that. Are some of your patients, are they in like an outpatient rehab setting part of the time and then bring in your team part of the time?
We get a lot of referrals. We get a lot of referrals from home health. We get a lot of referrals right out of rehab for that transition to try to figure out, okay, is this person going to go to a nursing home? And sometimes we get in there, and I have to say we're like social workers. So we spend a lot of time when we first see a patient and figure out, okay, what is it that this person needs? Is it the fact that, they don't have access to anything? Is it the fact that they can't get their medications? Is it something as simple as, they call 911 because they have anxiety because they can't get a medication that they need so desperately? And we have to figure out all the services that each person needs. Maybe they can't see and read their medications, and so they're not taking it right. And so then they call the hospital because they get sick and they don't realize they're taking the wrong meds. There's so many things that can happen when people are not able to take care of themselves or don't have the ability or are too weak. And I've walked into some pretty scary situations where I thought, oh my God, how did this person survive this long like this? So it's a forgotten population too.
Most people don't think about it, right?
Mm-mm. Nope.
So tell me a little bit about some of the challenges that you face on a day-to-day basis. Like what is the most pressing thing for you?
Ooh, boy. The biggest thing, the biggest thing I would say is probably communication. Communication is really hard with the elderly because one, they can't hear. They don't have technology. They don't have fax machines. They don't have cell phones. They don't have any way to get paperwork. And if they do answer the phone, sometimes they can't hear you because you have to realize that our population is somewhere between the ages of 70 to 100, but I'd say our average population is probably right around 80. So that's a real struggle. And they can't hear you half the time. And we make jokes about it in the office, but we hear people, literally sound like they're screaming next to you in the office and everybody's giggling at them because, Mr. Jones calls again and he can't hear you and he makes up things that he thinks you're saying. I mean, it's a very unique but fun, practice to be in with the elderly. But I would say communication and being able to access them when you are not in the home is one of our biggest challenge.
So do you have like a mission for your organization or is there something that really holds true throughout the organization? If you talk to one of your employees, like what is the company mission?
I would say to give the best care possible and to help the most amount of people. Everybody knows IHMS and they know that, to the core, that we really want to help people, in the most way and reach the most lives. I wish we could reach more people. It's really hard. We get probably more referrals than anyone else in the Valley. I mean, we get 150 to 200 referrals a month. But you also have to realize it's an elderly population. So, they only may be with us for 3 or 4 years, or, they may come to us and then they go on hospice. I mean, you just never know what the reason that they come on for. But I mean, that's what I would say to that.
So, tell me, what is the next step for IHMS?
We have a couple of things that we're working on right now. Actually, the biggest thing is, I guess my short term would be, I would like to get more involved in technology. So we're really trying to figure out how can we bring more technology into this, because we've got gas prices going up, right? So mobile is going to be even harder now, because if someone drives around all day and it's $100 plus to fill up their gas tank all the time, that's going to be an issue. So we're trying to incorporate some new stuff. Obviously, we're going to be expanding our clinic more so that way, that gives another option for patients for IHMS. But we're also going to be doing more televisits, and we're going to be working with the home health nurses when they go in and see the patients. We'll be able to do more like hands-on televisits when we add more remote monitoring into the homes. It's moving into technology more and figuring out how can we now reach out to the patients in a more technologic way so that everything doesn't have to be drivable. Do we do telemedicine twice a month and do a regular visit the third month? I mean, how do we make that happen? So I think everything's going to be coming in technology to make a difference.
Well, and you see so many companies today and large health systems and stuff like that really trying to solve that question as well. But when you're dealing with 80, 90-year-olds and up, that becomes a whole nother thing, right? You always want to have the easiest user experience, but there's limitations for certain individuals, inevitably.
Yeah. And so we still have to go out. I mean, and that's the thing. There are a lot of companies that might go and do mobile, but they do not want to, they don't want to drive to people's houses. They'll go to a facility and see 10 patients in a row, but they don't want to drive to individual houses. And that's kind of the commitment we have at IHMS. And the other commitment we have is we always try to see everybody within 24 to 48 hours to eliminate any kind of, bad things happening to them, because a lot can happen in 2 days. And that's the same thing. If they get out of the hospital, we always try to see them within 24 to 48 hours. And our mapping schedules work really well. So, we always have days throughout the week where we're in different cities. So if someone needs to go and be in that city to see that patient, that makes a huge difference. And I think that's another reason we get so many referrals, is because they know that it will be quick.
Right. And, you're talking about how many different situations arise. You rarely know what you're going to walk into. How does your staff and your team and your providers keep up with that? How do you how do you prepare for so many different variables?
Well, I think you get used to it. Is that a good word? I think when you've been doing, that's why you have to be a really special person to do this job, because only going out there and doing it really gets you prepared for it. I've had and the biggest thing is checking in on patients. So even if they don't answer the door and maybe they, the thing about our practice is, someone's habits. Once you go to their home, what they're like, if their TV's too loud, they can't hear you, or they can't hear the phone, that they sit by the door before your appointment, that they nap in the morning and they go to the, hairdresser that's, next door, their friend, at a certain time or whatever. You just know everything about them. And I think when you notice that doesn't happen, and that comes with experience.
It's interesting. And you mentioned earlier about how it's probably a lot of the kids of the parents who are looking for these types of services. And do you communicate a lot with them? Or are you going direct to the hospital? Yeah.
Yes. So they're like my parents, like parents who, if you have little kids that, for teachers and stuff, they are definitely what I consider like their parents at that point. But yes, we communicate all the time with the POAs. And a lot of times they're out of state. and they want to know what's going on. But we constantly have to have communication, because especially during the pandemic, because we'd be like, hey, we need you to go over and do a telemedicine visit because we can't come in because we're not vaccinated or they're not vaccinated, and we need to be able to see them. Or, we did window visits. it was crazy. We've never done anything like that. And even in some of the nursing homes, they were able to sit outside, and we were at like a fence between us.
Right.
We couldn't do vitals, but we could, sit there. They see you as family after a while. And that's a really cool thing. And that's something I never got in the clinic, is being able to go into someone's home and really get to know them. And you see their pictures and you learn their stories and you figure out what's going on with them. So.
Wow. That's fascinating. Yeah. Would never thought about that.
Yeah.
So listen, Brooke, it was a pleasure speaking with you. Tell us a little bit about how can people get in contact with you and learn more about your organization?
Yeah, so we have a website. It's ihmsgroup.com. You can always go on there and look at services. Our office is located in Chandler, Arizona. Contact us if you have a loved one that you're not able to find a place for, or you're just not sure what to do or what kind of services. And I know that there are similar things in other states that you can do as well. Usually social workers and caseworkers, if you call your insurance companies, usually they are aware of those kind of services that's provided under, each patient's insurance company.
That was actually something I want to ask. Like, I'm in New Jersey, right? Go to a social worker, they're a good resource. Or is there any online resources to even find somebody that may be not in Arizona?
Yeah, it's hard. It's not a huge industry. So, but as I said, with technology now, they're starting to have more technology where they can bring in, technology and do telemedicine visits on the phone if it's an urgent thing. But yeah, I would just look up mobile services in your area. And, for primary care, if you can find a mobile primary care that can come to your home and do these kind of things, you're set.
Sure. Well, listen, thank you so much for being here. It was a great conversation. I look forward to speaking again. And we'll talk soon.
Thank you so much for having me, Mike.
All right. Thank you.